Hey guys, Dr. Ben here at the Functional Medicine Centers, and I practice full-time in Fort Collins, Colorado. We just opened an office in Phoenix, Arizona. We will now have the Functional Medicine Center of Phoenix as well, and we work with patients all over the country. Probably 50-60% of our patients come from out of state, out of Colorado. But anyways, welcome. Hope your Sunday is going great here, everybody. I want to go over some really interesting statistics, some great facts, some things that we're seeing that are out there, and give you some hope, but then also give you some things to motivate you, to keep you active, keep you moving. One of the first things that we're looking at is kids, and are we damaging our kids? And we looked at a study that they were going from pre-COVID to post-lockdown, and they were looking at what activity level was going on, what the exercise rate, how much screen time, all these things that happened to kids when they went into lockdown. And what we saw that inactivity went up 44% in kids, so they were that much less active. And this, of course, it makes sense because they're not doing any of their regular exercise. Hey Vanda, how are you doing? Good to see you out there. If you guys are jumping on, go ahead and put down below where you're calling in from, any questions you have as we go through today. But go ahead and let us know where you guys are from or any other questions that you have. So anyway, screen time. So the amount of screen time went up 4 times. I've got 4 boys, and we saw this. It went from a Waldorf school that is out and about, and they're doing daily nature walks, and they're gardening, and they have outside hour-and-a-half recess, lots of things. And we went from there all the way down to being inside a lot of the day. Hey Elizabeth, how are you? Pueblo, hey Mike, how you doing? So here's what happened even in our household. It was very challenging. They went from being outside, doing all these things. Even for PE class, my 13-year-old, he came to me and said, Dad, I just don't feel like I should have to write a report for PE class. And this was one of the few times that I said, you know what, I'm gonna follow your lead on this, buddy, and let you not have to write something. Because this is major stress to the kids. Hey, who jumped on? Elizabeth, good to see you down in Thornton there. Wynn, good to see you, Colorado Springs. Karen, also from Colorado Springs, good to see you guys. So again, even my 4 boys, one of them was supposed to do a report for PE class when he was getting outside every day, hour, 2 hours, playing soccer. We've got a gym at the house. He was working out, doing all these things in there. And I told him, you know what? Even if you don't pass that class or don't get a very good grade, the 7th grade PE report that you had to write for that is not going to make or break you. So it was traumatic for the kids on a lot of levels. Their soccer that they were doing on a regular basis, all of these different things they were not allowed to do. So we're talking about a study where they saw pre and post lockdown for kids and what actually happened. They found screen time went from 600 minutes to almost 2,400 minutes per week when they went into lockdown. And some of that's school, obviously, but other parts, they can't get a hold of their friends, or maybe they're playing video games so they can connect with their friends, all these different things. But the really interesting part with this study was that they found that physical activity provides protection from viral infections. So what do we have to do? We've got to be physically active. And this is going to actually create prevention to those viral infections that are going on out there. For anybody jumping on, go ahead and say hi. Tell us where you're calling in from, and any questions, any comments through this process, go ahead and put them down below. We'll make this interactive in there. So again, the things we saw in the study for kids pre and post lockdown, inactivity went up 44%. So recesses were gone. A lot of times parents, maybe they weren't as engaged as they could be. Maybe they had to go to work, different things like that. So just not able to be there for the kids. Screen time went up 4 times, from about 600 minutes to almost 2,400 minutes. So are we, like my title said, are we actually fattening instead of flattening? The stress that this creates on the kids' bodies is dramatic. I've seen it in our own house, 4 boys, the oldest 15, all the way down to down to 8, and just the emotional toll that we're seeing it take, not being able to be with friends, not being able to go play. At least they've got 3 brothers that they can all interact with, but people with 1 kid or 2 kid. Hey, Roberta, good to see you. Laramie, are you guys getting rain up there? We're raining down here. So it's very stressful, not just physically, but also mentally and emotionally, and just the kids constantly hearing about it and the stress and the strain and all those things. So we've got to be able to keep active, get our kids active, and that's why I'm hoping and praying that we can get back to school in the fall, and that the governors for whatever state you're in will allow schools to open back up. We've got to get the kids active. Great news is that when we're talking about kids and COVID, there's hardly any cases where kids under 20 have died from COVID. So that's the great news. Even as we open schools back up, they are at a very, very low risk from that. Hey, Donna, good to see you. Snowed this morning. Wow. Elizabeth, yeah, thanks for speaking about the kids. And it is so true. We've got to get back out there. We've got to get back into that school setting. And whether you homeschool or you don't, and you want your kids to go back to school, for a lot of these kids, I've heard multiple patients work with the Child Protective Services, and they say that the reporters, the counselors, the teachers, those people that report any type of neglect or damage or abuse or anything like that, they're not seeing the kids. So their numbers actually aren't up very much, but it's because they're not seeing it. And unfortunately, a lot of the kids being at home all the time is very traumatic. The other thing we see with the kids is that this is creating a bigger divide. We're fortunate enough that we do have multiple iPads or computers the kids can be on. We have internet. My wife was able to be home with the kids, help the kids through this process, but there's a lot of families, a lot of lower income families that don't have the computers or the internet, don't even speak English. And so that divide is being created even bigger and bigger and bigger. So my hope and prayers, especially for our own family, is that we can get school up and running, and that they do allow our schools to get going there. So let's see, one other question there. All right, so another really interesting thing that we looked at. There was a study done where they looked, it's called R0, but you pronounce it not, R not, and it basically tells us how contagious something is. So whether that's the flu, whether that's COVID-19, whether that's measles, anything like this, they look at how contagious a certain virus, bacteria, whatever it is, actually is. Originally, and this was like a month ago or 2 months ago, they said that COVID-19 was 6 on a scale of 1 being able to contagious, being able to get that virus over to one other person. 2 would be 1 person would infect 2 people, 1 person would infect 3 people if it was a 3. So they said COVID-19 was a 6. So 1 person could infect 6. But now what we're down to, even after we open up, we're down where the CDC, they just came out with this a couple days ago, we're under 1 on that report at this point. So instead of it being 1 person infects 6, 1 person infects less than 1. So what does that mean? Even in spite of opening things up, even in spite of everything that we're doing at this point, this virus is going to go away on its own, and this virus is going to burn out. We've been talking about this for weeks now. What's going to happen first? Are we going to burn out as far as the virus goes, or are we going to be able to get a vaccine in place? And my hope, obviously, is that the virus burns out, and even by the end of this summer or by the fall, it is pretty much gone and it's not a pandemic. Slovenia, one of the first European countries to actually say that we are no longer in a pandemic in that country. So we're already seeing this happen a lot of different places where it is burning out, where we're not infecting as many as we thought, or hopefully that they thought it was going to be. So originally they said it was going to be 1 person would infect 6 people. Now we're seeing that it's 1 person infects less than 1 person. And this was the CDC came out and said that this week. So in that what is actually going on there, it will go away on its own. It will burn itself out, which is the great news. Number 1 thing you could take away from this. The next thing that the CDC came out with this week was an estimate on fatality rate, and they said a fatality rate of 0.4% of symptomatic people. Seasonal flu, 0.1 to 0.2%. COVID-19, they said of symptomatic people, it was 0.4% fatality rate. But they also said that there was a 35% rate of asymptomatic people, meaning 35% of the people that had COVID-19 had no symptoms. So 35%, when you figure that together, it's a fatality rate of 0.26%. And this is actually a couple weeks ago or last month, Stanford University did a study where they looked at antibody tests and said that it was going to be about 0.1 to 0.2.5%. And it's right where that study was saying even a month ago. So great news again, fatality rate way lower than what they originally thought. Remember when we shut down, World Health Organization was saying 3.5%, going to be 2 million people were going to die, 80-90% of the population. Totally not that. Unfortunately, people have died. Unfortunately, there is some hurt, some sorrow, some sadness out there. But the great news is not what they thought it was going to be. And as we open things back up, totally makes sense. We've got to get the economy going, got to get people moving, get them exercising, get mentally stable, because the damage that we're creating from those long term could be way more damaging than the virus ever did. So CDC rates that they're estimating now is 0.26% fatality rate, way lower than what they were thinking as well. And then the other thing that people are always asking or talking about is masks and what is going on with masks. And let me see if we can, I lost the, there we go. All right. Hey, Robert over in Greeley, good to see you. Elizabeth, kids bike riding 4 and 5 times per day, playing soccer with siblings. That's great. Got a little rain and snow. Hey, Shoshona, how are you? All right, so here's the last one. So everybody asks about masks. I mean, it's getting to be this big thing. Like even in North Dakota, the governor was saying, hey guys, don't be divided on this. If somebody's wearing a mask, don't shame them. If somebody's not wearing a mask, don't shame them. You know, it's definitely a thing. Hey Deb, good to see you. It's definitely a thing that we need to be sensitive of other people. I've had patients, I've had a lot of interactions, a lot of questions. Here's the thing that I do know. The research showing that cloth masks can actually be detrimental long term, especially if somebody isn't cleaning them. So if you made a cloth mask, if grandma made a cloth mask for you, you shouldn't be wearing it day after day after day and not cleaning it. My suggestion is at the most 1 day of wearing a mask. If you're at work or something like that, then you may even want to bring 2 or 3, because think about this. You're keeping a moist environment, especially in a cloth mask, moist environment, you're breathing, all those things that they say you should be afraid of at the store, you know, somebody even talking or singing at church or any of these things. If you're in that moist environment there with that mask and you're not cleaning it, not changing it, it's going to breed infection. It's going to get up in your sinuses. There's going to be a lot more problems down the road. So if you are using a cloth mask and you have to do that for work or whatever it is, especially if you're doing it day after day, you've got to make sure you're cleaning it. You've got to make sure that you're, whether that's putting it in the oven and getting up to a certain temperature, or if you can run it through the washing machine, whatever you can do, you've got to make sure that's happening, because that moisture is going to increase that infection rate. So that definitely has to happen. If you're in a medical facility, you definitely should wear a medical grade mask. Even the surgery grade is going to be fine for most people there. On that note, you know, it's pretty interesting. I had a patient last week. She worked with patients that had MERS. She used to be in the military. She was a medic, and she thought it was really interesting because she wore a mask and gloves and things as the healthcare provider, but the patient never did, which was pretty interesting. And so, you know, that the good part is, even if you feel like you need to wear a mask, but if somebody else is not wearing a mask, don't worry, because you have a mask on, and even if they sneezed or whatever, you know, hopefully you're wearing the mask appropriately and it's tight and all those things, and so you're not going to get infected as readily as you could. But so don't worry about that other person not wearing the mask. Take care of yourself if you feel like you need one. If you don't feel like you want, and the local ordinances say you don't have to, then just take care of your body. Just a lot of those things that we've been doing. Diana, hairdresser, and when the clients are required to wear the mask. So here's the deal. Cloth masks are not going to be that effective. There's a lot of material, a lot of viruses that can go through the mask. Most people, if you walk around Costco or Walmart, they look like this, and it's kind of sticking out here. I actually saw a guy at Costco. He had 2 rubber bands and a face cloth just hanging down like this. It was crazy. And so for most people, there's still going to be viruses coming in, bugs, especially if you're sitting in an environment like that all day long. So think about this. I look at what they want to do with kids. They want to put these sneeze guards up in between the kids' desk at school next year. And who remembers, do a thumbs up if you remember this, sitting in a restaurant that had a non-smoking and a smoking section. Anybody remember that? Smoking and non-smoking. So what would they have? They would have this piece of glass, a wood frame around it, gap in between, and what would happen? That smoke would come over. And if you sat there long enough, you would still smell smoke, you would get smoke on your clothes, whatever. So same thing, these sneeze guards, if these kids are going to be sitting in the classrooms for 8 hours a day, what is a sneeze guard going to do? Those viruses, people don't understand that bugs and germs and viruses, they get transmitted way differently than just from our mouth. It's not just from our mouth and our nose and sneezing, things like that. They're going to go through the duct system. They're going to go all over, travel a lot of other ways than just through us. Robert, you and your wife had to go to the ER yesterday. She's 8 months pregnant, had to wear a mask for about 8 hours. Yeah, that's not much fun there. Providing surgery masks to clients would be more helpful. Diana, if you really are concerned, or your clients are concerned about the mask, then yes, that would be a better way to go than the cloth mask, just because it's going to be very, very challenging. Legally, no, all they need is a facial covering, whether that's a scarf or a cloth one that they make, anything like that. But yes, a surgery mask would definitely be a step up from a cloth mask. But remember, it's all about people's terrain. We've been talking about this all along. Louis Pasteur said it's not about the bug, it's about the terrain. And so for you as a provider, getting your body as healthy as feasibly possible, you've got to be able to fight anything off. Elizabeth, same thing. Good question. You're a massage therapist. Yes, if that patient or that client is seriously concerned and they are very, very concerned about getting infected, a surgical mask would be a step up from a cloth mask, especially if you're going to be with them for greater than 30 minutes. The research is showing that the longer you're in a setting, the more likely it is going to be to get infected. Of course, that's what's going on. But great news is, remember, we just talked about this, the R naught, which is how contagious something is, and a virus, a bacteria, anything like that. At first they said that it was a 6, meaning that one person could infect 6 people. Now the CDC just came out this week and said that one person is going to infect less than one person. I've had patients that live in the same house, in the same bed, they're married, they kiss, they hug, they drink out of the same glass. One person had the infection, had the antibodies, everything, and the other person had no symptoms at all. So it's not going to be that everybody that is exposed to this is going to get infected. That's just not how viruses work. That's not how the flu works. Speaking of the flu, the seasonal flu is 1.2 on that R naught value, and the COVID-19 is actually less than 1, is what CDC is saying. Yeah, Elizabeth, what are they going to be doing in classrooms, and how can they do football and some of these different things? So, again, the great news is that kids are, it's almost non-existent that there are deaths to kids from COVID-19. There may be a case here or there around the world, but it is almost zero. It's a way greater chance of dying from the seasonal flu for kids than it is from COVID-19. So that's the great news. And really, on some level, we want our kids getting the infection. We want them having the virus so that we can keep creating these antibodies. But remember, it's not as contagious as they thought it was. And so, eating in classroom, sure, that's going to, keep kids from being all in one conglomerate. But remember, these bugs are going to be circling in through the duct system. It's going to be floating around, just like back when you used to go to the restaurant. There was a smoking and non-smoking section. They would that smoke would get everywhere, and that's what's going to happen with germs and all these things. So we've got to make sure that our immune system is as good as possible. If you have kids, work on it all summer long. Get their vitamin D up. All these things. How can they allow football? How can they allow some of these different things? Again, we've got to live our life at some point. And the great news with kids is that they're not going to have the major problems that somebody over 70, 75, 80, which is where most of the problems are. So 2 stylists in Missouri tested positive for COVID, and they serviced about 140 clients. I saw that, Diana. And you know what? I'm really curious, because it's going to be hard to get this information, how many of those clients actually show up positive. So here's the deal. If you're sick, if you have a fever, if you have a cough, any of those things, obviously take precautions. I would hope that you as a stylist would, even with the seasonal flu, wouldn't be going in and sneezing on people and all of those things. So this is going to happen. And so, but here's the thing. I'm sure there are people that are saying that those stylists in Missouri, if somebody dies from COVID that had got infected from them, that they should be filed for manslaughter. But here's what I also have to say. In New York State, I don't know if you guys saw this or not, but last week, Governor Cuomo came out and said, hey, you know what? Actually, you don't have to send COVID patients to the retirement centers. On March 25th, in New York State, they made a law that said that everybody that had COVID had to go to whatever retirement home or whatever they had. They could not restrict where those people went. And they were doing that so that the hospitals wouldn't go overwhelmed. So they said, hey, retirement homes, you have to take these COVID patients. And so for 2 months, they let COVID patients go into retirement homes, and that 5,800 people in New York State died in retirement homes with COVID-19. I don't know if it was from COVID-19, but it was with COVID-19. So what does that mean? Well, we have to be careful, and for people that are saying that these stylists in Missouri should be, we should press charges, whatever we should do. Well, you know what? States have been doing this in the retirement homes, all types of different things. So it's not a simple black and white story there. Hey Melissa, I'll get you some more information on that. I'll post that for you guys. But Melissa, I didn't see the last question, last part of the question there. Go ahead and repeat that one, and I'll go in and say it again. So again, let's recap on some of the things that we're looking at. Are we damaging our kids? Inactivity rate pre to post lockdown went up 44% in the study. Screen time went up 4 times, from 600 minutes a week up to 2,400 minutes. And we know that physical activity provides protection from viral infections. So people have to be active, they have to be moving, they have to get up and go and have that exercise to actually fight off viruses. So one of the worst things we could do is lock ourselves in the basement and not get outside. You need to get vitamin D from the sun. You need to get fresh air. You need to get moving, especially if you're in a place like Phoenix or someplace really hot. It's really hard for viruses to survive over 100, 110, 112 degrees. So watch those rates in Phoenix. They're going to drop dramatically. There's not going to be hardly anything this summer. Great news is, again, even last week they were showing that 28 of the states that have opened up, the rates are still dropping dramatically. So we've got a lot of good news out there. CDC estimates the fatality rate is actually 0.26% instead of what the World Health Organization said, 3.5% when they shut everything down. So way, way, way better fatality rate than we thought when we shut everything down. And as far as masks goes, there's a bunch of questions. Scroll up ahead or go back and watch this again. But cloth masks, a lot of research showing that there is a very good chance of actually having more infection. You've got to wash the mask. You've got to use it only once for one day. If you're using it all day long, I would have 2 or 3 with me for that. At work, where I have to wear a surgical one, I'm going through 2 or 3 a day. I just do not like to be breathing in that humidity and germs. I have patients that they have to wear them all day outside, and they're breaking out. They're getting acne. They're getting infection on their face just from sitting there all day long on there. So what's it doing to your sinuses, to all those things? Hey, Dave. Okay, yeah, shoot us over. Dave, do Dr. DOCTOR at fmcenters.com, and let me know if I can help you with anything. Yeah, definitely, Heather, struggling without soccer. I mean, it's so sad, and people work so hard and they practice. My 10-year-old, he's been doing this thing called dribble up, where every day, like 3 times a day, he practices soccer, dribbling this way, going that way, and everything. His skills have gotten phenomenally better, and yet he was not able to. Get to play this year, and maybe this summer. Hey, I just tried to order some masks from Amazon. Most of them are produced in China. I would say 95% of the masks are going to be made in China, So hard to say if those are healthy, if they're very, very good quality, things like that. So definitely challenging on where to get some masks from. But remember, if you are using cloth masks and you are immunocompromised, or if you're really worried about getting sick, you've got to make sure that it's form-fitting, and you've got to make sure that you're washing it at least daily, if not more often than that, because those are going to hold germs. They're going to breed infection, and especially up into the sinuses, we're going to see some of those infections as well. So, all right, guys, thanks for jumping on. If you've got any other questions, shoot them below. I'll be answering those throughout the rest of the day. But again, we've got to get ourselves out, get that vitamin D, get the breath going, get the exercise going, all those things on a regular basis. So hope you guys are well, and take care. Have a great day.